So I will be talking to you all about yoga, and my name is Katie Broderick. Okay, so what is yoga? Oops. What is yoga? Yoga is a mind-body practice. Many people know it as a series of stretches that you might do in a studio or in a class. It is a very popular form of exercise. Originally, it was um, event created in India over 5,000 years ago, and it has been divided into 5 different historical periods that include the Vedic period, um, pre-classical, classical, post-classical, and modern. Um, the Vedas are the earliest known texts related to Hinduism, and the Sanskrit word Veda means knowledge, while the Sanskrit word Rig means praise. Vedic yoga is a very archaic yoga, and it's connected to a ritual of life of ancient Indians. So the pre-classical yoga is about 2,000 years old, and it's still related to the Vedic style. It calls for movement. It's said to be what it means is that to be alive is to be active, and that basically our actions should go beyond the ego and search for altruistic means of connection. Classical yoga is brought about by Ashtanga yoga, which is a popular form of yoga today. It is an eightfold system, and I will go on to explain more a little bit later. Post-classical yoga is a period that emphasized the unity of everything. The yogis during this time collaborated with alchemy to come up with new postures and exercises that would rejuvenate the body and increase longevity. This also created Hatha yoga, which is a very popular form of yoga as well. Modern yoga is thought to have first begun in Chicago. It's basically the popularized version of many types of yoga that include power yoga, restorative yoga. Um, it is incredibly accessible through public community classes, recreation centers, technology. There are apps that can guide you through yoga, which is really cool because you can do it right at home. So there are 6 branches of yoga, and excuse me for my mispronunciation, but there's Hatha, which is the physical and mental branch that is designed to prime the body and mind. It's otherwise known as like a very slow-moving yoga. Raja yoga is meditation, and it is a adherence to a series of disciplinary steps. Karma yoga is the the type that aims to create a future free of negativity and selfishness. Bhakti yoga is the yoga path of devotion and a positive way to understand our emotions and cultivate acceptance and tolerance for our fellow human beings. Um, Jnana yoga is the branch of yoga that is um, in the pursuit of wisdom, intellect, and all things scholarly. Tantra yoga is meant to be the pathway of ritual and ceremony, such as the consummation of a relationship. So there are many types of yoga within these branches, and a few of them are um, so Bikram is also known as hot yoga, and it consists of a series of 26 poses and a sequence of 2 breathing exercises. It is incredibly difficult, um, but very rewarding afterwards. Hatha yoga is the generic term for any type of yoga that teaches any physical posture, but Hatha classes are usually a more gentle introduction into basic yoga. Ashtanga yoga is um, the ancient yoga teaching I spoke about before, and it became very popular during the 70s. It's established certain established sequences of postures that link every movement to every breath, and it's the same series over and over again, like Bikram. Iyengar is the type of yoga that uses props with poses like blankets, straps, chairs, and blocks. Hiva Mukti yoga is something that we understand to be vinyasa, its more popular name, it is a very fast-paced flow of poses, and it is incredibly taxing on the body. It is very aerobically difficult, so don't let anyone tell you that yoga is not difficult. Power yoga is an active athletic type of yoga, and yin is quiet, it's meditative, and it focuses on the release of tension in joints like your ankles, knees, hips. Restorative yoga is just as it sounds. It's relaxing. It's meant to be a series of simple poses. You can use hot blankets or bolsters. It forces you to deeply relax into your muscles without overexerting yourself. So, precautions. Some precautions include dehydration. Any exercise should be preceded and followed with fluid consumption, enough to keep you hydrated throughout the practice, and enough to promote circulation and prevent lactic acid buildup. Yoga can be as gentle as you make it, but someone with a heart condition should definitely consult their doctor before attempting yoga. Controlling your heart rate and keeping it within a healthy range is vital for a vulnerable heart, and it is important to monitor your blood pressure before practicing. Orthostatic hypotension could lead to fainting or further injury. People should listen to their trained instructors as not to overextend any muscle group. Practicing outside your scope can lead to chronic injuries. So with any exercise, also it is important not to imbibe, especially with yoga, because it impacts the body and mind connection. Pregnancy and yoga have been proven to be very effective as long as the doctor's orders are followed. So some uses and benefits. There are so many benefits to yoga. Yoga has the ability to reduce stress over time as it encourages deep breathing, stretching, and mindfulness, or a reminder that you are present and one with yourself. It can slow heart rate, which benefits everyone, but especially those who have hypertension or heart disease or have had a stroke. Paying attention to your breath can help you relax. Flexibility will increase with the amount of stretching required. Abdominal muscles will strengthen, which will increase posture. So, some limitations. It is easy to do yoga improperly, and doing so can definitely further risk of injury. You should never lean into a stretch that causes pain or stay in a stretch because someone told you to. Good instructors will have you listen to your body and guide you through practice rather than tell you or push you to. Distractions are to be left at your door, but as we know, that is not always possible. The goal is to connect the mind and body so you stay present during practice and you are solely focused on your movement. Yes. So injuries definitely can limit mobility and function during yoga, but the beauty of it is that it accommodates for many types. So just remember to listen to your doctor and listen to your body. So yoga can be implemented in nursing care. Some hospitals have rehabilitation services that offer yoga to patients if it is recommended by their doctor. Nurses can offer education to patients or, if applicable, instruct them on certain poses. Early ambulation is essential for recovery, especially after surgery. So again, per doctor's orders, it might be suitable for a patient to practice poses in bed or practice sitting up and down, breathing in and out, focusing on breath. We should educate clients on benefits, limitations, and risks. Yoga, when done correctly, is an act of self-care, and it can restore the mind-body connection. Education regarding proper body mechanics is very important. Patients should be instructed not to practice outside their scope and make it appropriate, definitely for their recovery, whatever that may be. We have to remind patients to think about their fluid balance and hydrate before and after. Yoga is one of my favorite forms of exercise, and it keeps me grounded. It's a non-discriminatory practice. Life is stressful and definitely has the opportunity to offer reprieve from the chaos. Nurses have the opportunity to present education on the benefits of yoga and encourage clients to look into it. With the right training, we might even be able to guide patients and ourselves in the practice when appropriate. So how can you incorporate yoga into your nursing practice, and how do you think yoga can improve your own mental and physical health? Here's my references, and thank you very much.